That's very exciting. And we have a paper coming out in about 2 weeks. It just has been accepted. When we are looking for disease in the brain, in the diagnostic setting, or even on the research setting, again, we use antibodies to detect changes caused by this disease. So for instance, in the case of Alzheimer's disease, we are looking for tau changes and amyloid changes. So for this, we use antibodies. So which antibodies do we use? The field kind of came up with certain antibodies that we believe are expressed in every disease, in every step of the disease. It's almost like a screening, if it's not detected by these antibodies because it's not there. And in the case of tau, it's antibody against phospho-tau. Now, with this study, again, using this technology that we can label different markers at the same time in tissue, we realize that there are other types of tau changes that, at least the experimental models, are very harmful to the cell, that when they are, or when they express in the cell, we don't have phospho-tau in the same cell. So it means that if we take 100 neurons and we look for tau changes, and let's say that we find that 40 of them will have these phospho-tau changes. So what we'll do about it, we say, okay, these neurons that have the phospho-tau changes, they are the most vulnerable. So these are the ones we are trying to understand the selective vulnerability. These are the ones we are trying to understand the secrets. With this study, we detected that another probably 30 neurons of these 100 will have truncated tau, which is very toxic, but they don't have phospho-tau. So we had never imagined that they were sick if we were not doing this multiplex analysis. Now, what we do with this? So several things. So first, there are different class of neurons that seems to be vulnerable to a different pathway. So just treating for phospho-tau probably won't do the trick. The second thing that's even more exciting is that this other type of tau, this truncated tau, it's usually caused by activation of something called caspase-6. So caspase-6 is a molecule that has been associated with cell death, with apoptosis. But more recent studies have been shown that caspase-6, especially in the brain, has other activities. And one of these is to truncate tau. And there are drugs being developed to inhibit caspase-6 activity. So this class of neurons not only are excited to be discovered because we are seeing part of the disease that we didn't know before, but it seems that there is a therapeutic avenue for dealing with these changes. And then, of course, can be a game changer in people with Alzheimer's disease in terms of treatment.